Welcome to This Explainer. Look, if you're working as a personal care assistant, a PCA, you already know the deal. Managing dementia-related agitation and anxiety, it's easily one of the toughest, most emotionally demanding parts of your job. So today, we're pulling directly from our source material to give you some crystal clear, incredibly empathetic strategies to handle those sudden emotional outbursts. We're going to look at how just making a few simple shifts in your day-to-day approach can absolutely transform the quality of care you're providing. And honestly, it's going to make your shifts a whole lot smoother too.
I'm just frustrated and I don't know what to do. Wow. If you are a PCA, I guarantee you've felt this exact way at least once. You show up, you're trying your absolute best to help, and then out of nowhere, a patient who literally relies on you for basic daily needs just puts up a wall. They become incredibly resistant. It is completely normal to feel a bit lost or frustrated when that happens. But today, we're going to figure out exactly how to break through that wall.
All right, so here is our roadmap for today. 1. The PCA Caregiving Challenge. 2. Recognizing agitation and anxiety. 3. Understanding the hidden triggers. 4. The power of your approach. 5. A better way forward. And 6. Essential tips for PCAs. Okay, let's jump into part 1. The PCA Caregiving Challenge. Navigating the morning routine.
So let's kick things off with a super common hurdle, which is navigating a highly stressful dressing routine where the patient is just flat out refusing help. Now, we've all been there, right? Trying to negotiate with a toddler is one thing, but negotiating with an 80-year-old who is absolutely dead set on wearing a heavy winter coat on an 80-degree day, yeah, that takes a very special kind of patience. Just picture it. You're trying to get them out the door for a doctor's appointment. The clock is ticking. You point out that they've made a mistake and you tell them they really need to hurry up. And what happens? The patient immediately feels attacked. They yell, "Leave me alone, I can do it myself," and boom, the whole routine completely derails into an argument.
Which brings us to part 2, recognizing agitation and anxiety, spotting the physical signs. As a caregiver, you've really got to be a detective when it comes to body language. You need to catch exactly when that everyday stress boils over into clinical agitation. When a patient gets overwhelmed, you're going to physically see it. They'll have a hard time sitting still, you'll see pacing around the room or constant fidgeting, they might start acting really irritable, or on the flip side, they might just look incredibly afraid, nervous, or worried. And of course, the most obvious sign, they start actively batting away your help. Catching these physical cues early, that is your absolute best defense against a full-blown escalation. Moving right along to section 3, understanding the hidden triggers, the why behind the resistance. The real secret here is figuring out why they're acting out, instead of just reacting to the behavior itself. A lot of the time, it boils down to something called impaired insight. Basically, this is the inability of someone with dementia to actually understand their own cognitive limits. Because of the physical changes happening in their brain due to the disease, they literally do not see themselves as having a problem. In their reality, they are fine. So think about it from their perspective. Any attempt you make to force your help on them feels completely uncalled for. It feels intrusive. But beyond just impaired insight, there are other hidden triggers. And honestly, it is rarely about you. Usually, the patient is feeling a sudden, terrifying loss of control over their life. Or maybe they're misperceiving your attempts to help as an actual physical threat. It might be an unmet physical need that they just can't communicate clearly anymore. Or, it could just be simple frustration with a task or a sudden change in their daily routine. Once you pinpoint the actual trigger, you can actually solve the problem.
Okay, section 4, the power of your approach, the psychological feedback loop.
This brings us to literally the most powerful tool you have in your entire toolkit, your own vibe, your own behavior. Patients absolutely sense your mood. It's like this giant psychological feedback loop. If you rush into that room feeling angry or impatient or stressed because you're behind schedule, they become a mirror. They are going to immediately react to that negative energy with resistance and anxiety. You have to remember, folks with dementia are reacting directly to how you approach them and the tone you use when you speak. Let's break down how a routine task goes completely sideways. Step 1, you rush the patient. Step 2, they pick up on that irritability and instantly feel threatened. Step 3, their agitation and anxiety just skyrocket. And then step 4, the inappropriate behaviors happen. Because their brain can't process being rushed, their fight or flight response just takes over. That's when you see hitting or biting. If you don't intentionally check your own energy at the door, this kind of escalation is practically guaranteed. So let's fix it. Section 5, a better way forward. We're going to rerun that morning routine.
Let's rewind the tape on that chaotic dressing scenario from earlier, but this time we'll use a totally different strategy. The failed approach was all about correcting and rushing, right? Are you seriously wearing that? It's 80 degrees, let's hurry. Bam, instant defensiveness. Instead, try giving them simple, controlled choices. Try saying, "What would you like to wear today? You look so good in the green or the blue." Do you see the difference? It completely removes the threat of being bossed around, and it instantly restores their dignity and their sense of control.
Now, if they still get a little ruffled, try this magic phrase. "I'm sorry that I made you feel that way. We can do this together." Validating their feelings like that diffuses anger so incredibly fast. On top of that, try using a positive incentive. Something like, "Hey, let's go grab some ice cream after the doctor." That pivots the whole interaction from a battle of wills into a partnership. You're proving that you are on their team.
Finally, Section 6, Essential Tips for PCAs, Actionable Takeaways for Daily Care.
Let's boil this all down into some highly practical tips you can use on your very next shift. First rule of caregiving, never ever rush. Always build an extra time for tasks. Second, use a really gentle, calming tone of voice. But, and this is crucial, do not sound condescending or use baby talk. Third, keep your body language open and positive and use a gentle touch to guide them. And lastly, give reassurance instead of barking orders. Just let them know they are safe and you're there to help. Now this next tip, absolute game changer for care planning. You need to schedule activities around the patient's natural rhythm. If they've always been an early bird, schedule the heavy lifting tasks and doctor's visits for the morning when they're at their best. Are they a night owl? Move those appointments to the afternoon. By just working with their internal clock instead of against it, you wipe out a massive source of anxiety before it even has a chance to start. And finally, hack their physical environment. Go in and thin out the closet so it's not a visual nightmare for them to process. Give them fewer clothing options so they don't hit decision fatigue. And make sure the clothes you do leave out are physically easy to put on. By just curating the space around them, you strip away so much unnecessary confusion from their daily routine. So, as you gear up for your next PCA shift, I want you to ask yourself one simple question. What mood are you bringing into your patient's room today? Remember, their reality is a direct reflection of your approach. Are you walking in with chaos or are you bringing the calm? Because the moment you change your approach, you quite literally change their entire world. Thank you so much for hanging out with me for this explainer. I really hope these strategies make your amazing caregiving work just a little bit easier.